Hello everyone, welcome to Rehabilitation Sciences Group YouTube channel, and now we are here with again with another session and very uncommon topic, but very important topic: electrotherapy simplified. And we have very senior ma'am, Dr. Bhavana today, and Dr. Sagun. He will be moderating this session, and he'll formally introduce Dr. Bhavana here. Dr. Sagun, over to you. We can start the session, sir.
Good evening, everybody. We welcome to Rehabilitation Science Group. Today we are having privilege to have Dr. Bhavana ma'am with us. She is taking on the simplified electrotherapy. Dr. Bhavana ma'am is a master of physiotherapy in musculoskeletal conditions. She is a proud alumni of Government Physiotherapy College, Vadodara, where she has passed her bachelor's in physiotherapy in 1994. She is in profession of physiotherapy since last 24 years and in academic since last 17 years. Presently, ma'am is pursuing her PhD from Gujarat University and soon she will be get her degree. Presently, she is working as principal of Ahmedabad Institute of Medical Sciences since 2013. She has presented her talk at many national and as well as state level conferences. She has given her expert talk on many topics on TV programs. Presently, she is being selected as state head of Indian Association of Physiotherapists, Women Cell of Gujarat State. We welcome you, ma'am. Thank you, ma'am, for giving us time. Thank you, ma'am. Good evening, ma'am. Over to you, ma'am.
Good evening, all. This is Dr. Bhavana Gadhavi, and I'm very much thankful to rehabilitation. Yes. Okay. Good evening, everyone. Am I audible to all?
Yes, ma'am, you can continue.
Hello?
You can continue, ma'am.
Yes, ma'am, you can continue. Yes,
Yes,
ma'am.
yes, you can continue.
Yes, you are audible, ma'am.
Hello?
Yes, ma'am, you can continue.
Am I audible to all?
Yes, yes.
Okay. Good evening, everyone. I'm today we are here on this virtual platform on the topic called Electrotherapy Simplified. As you all know, electrotherapy is been the initial physiotherapy intervention when physiotherapy actually started into practice. Maybe the hi-fi installations was not being, but really we actually using electrical stimulation with the for the rehabilitation in the initial years of physiotherapy practices. So today I would just like to enlighten for the electrotherapy basic principles and basic effects and its implementation. It's very untouched for the webinars or seminars like these things, because in this new era of recent advances and so many evidence-based practice we are doing, electrotherapy is being neglected for considering as a crucial part of physiotherapy. But as everybody knows, When we are student, we are not focusing much on electrotherapy, or it's a taboo to say that we use electrotherapy for pain. We actually we sims ourselves hi-fi by using so many other more techniques like manual therapy and other things. But electrotherapy is a basic necessity for our treatment protocol. So, if we start with the name electrotherapy, that means some authorities prefer the term electrophysical agents, because it is a physical agents which we are actually in giving the energy to the body, which could be which encompasses the wider range. It's not a substitute. Like it is not if you can say that electrotherapy and exercise therapy, they go hand in hand. So it's not a substitute for exercises, or electrotherapy cannot be used as a substitute for the exercise therapy or manual therapy. They both have its different role into physiotherapy rehabilitation, right? But a legit use of electrotherapy is very much important. We have this as a key to get results, but we need to use that judiciary. So what are the basic principles, or on what basis the electrotherapy works? So there are three components in electrotherapy effects. First is physical component. So when we give energy to the body or the part of body, then there would be physical reaction. This physical reaction will in turn leads to physiological reaction of the body, and in turns gives rise to therapeutic effect. So it cumulative gives rise to the effect. As a physical agents, we get the results. Now, starting from the basic of body's mechanism on injury or effect of injury on tissue. So whenever there is any injury, so considering here the injury may be microtrauma or macrotrauma. Now, what is macrotrauma? Is a major injury. When there is an injury, then that tissue gets damaged at a wider level. But whenever there is a microtrauma, so first of all, I would just enlighten with the microtrauma things. Is microtrauma is usually a repetitive strenuous injury. So small amount of injuries carried out every time whenever there is biomechanical derangement, or whenever there is abnormal weight bearing, or whenever there is wear and tear, friction. So any of these factors would lead to microtrauma to the area or to the structure. Structure may be muscular, maybe tendinous, maybe ligamentous, maybe articular cartilage, or it may be bursa, or it may be a synovial membrane capsule. So there are many structures which surrounds around the joint or into the part of the body. So maybe the muscle bulk, muscle belly, or maybe the tendons. So here the tissue, whatever the tissue is being repeatedly being loaded with abnormal weight, then it gets torn off. But it is the body's mechanism to repair it by itself. So whenever there is tearing or whenever there is injury to structure, so I am talking about macrotrauma as well as microtrauma. So whenever there is macrotrauma, the bleeding phase happens. Otherwise, if there is only microtrauma, then the first phase of tissue repair is not there. It directly comes with the inflammatory phase. So there are 4 phases of tissue injury: bleeding, inflammation, proliferation, and remodeling. So inflammation is actually a repair phase for the body. It is a reaction of body's tissue to repair the injury. So it is good. So many a times when patient comes with pain or when patient comes with swelling, and when we want to use the electrotherapeutic modality, this inflammation is a sign for us to select the electrotherapeutic modalities. So it is very important for us to understand why inflammation is there and what is actually the objective of getting inflammation as a positive signal. So bleeding phase is there if it is macrotrauma, otherwise there is inflammation, then there is a proliferation. So during that inflammation, it is tissue which is embarking. The tissue which is crying, which is being injured is crying now. So that the brain comes to know that there is injury, and brain sends the signals for repair. So during inflammatory phase, there is increase in the blood circulation, there is increase in the nutrients to like during that there is damage to the tissue also, and then there is repair to the tissue later on into the proliferative phase. And after proliferative phase, there is a remodeling phase. So once the tissue is healed or getting regenerated, it remolds by itself into its original shape and size. But considering this chemically, so whenever they in a normal body also we have a currents like positive current, positive ions and negative ions inside our body or cell, if we consider. So inside the cell there is a constant movement of this positive and negative ions through the cell membrane. But whenever the tissue gets damaged, there is hampering of this movement, or there is, if there is like there are two things. Either sometimes it is hampering due to the cell membrane like stops the transfer of the ions, or there is cell membrane may be embarking repair, so there is excessive exchange of the ions through the membrane. It depends on the injury, it depends on the structure, it depends on the healing process or the surrounding or the other underlying conditions. So these ions or we call it as body currents, they get altered and it is called injury currents. So whenever there is injury, there is a change in the positive and negative concentration of the ions within the cell and outside the cell, or extracellular and intracellular matrix. So this, due to chemical reactions, injury, there would be injury currents in the body. Now whenever there is injury current, the energy system works, or in the living cell may start reacting to the injury. So there are four ways the cell membrane that reacts, or the energy system works. So first way is, if you can see into the figure, this is a cell and this is a cell membrane, and there is a constant exchange of the ions through the membrane. Now if the reaction to the membrane may be of the membrane, so it delivers the whatever the injury currents is there, it causes the transfer of the energy through the cell membrane. Second, it delivers the smaller energy level of to tickle, and instead of forcing the membrane to change the behavior, it just tickles the cell membrane so that it starts enhancing its working. So first is it itself, the injury current itself enhances the working of the cell membrane. Second, it just increases the cell membrane permeability or enhance the cell membrane's reaction to injury. And third is the excited cells which do not work rather than the modality itself. So sometimes what happens when you give any energy outside, or maybe the injury current within the body, they causes the natural process of healing, or natural process of proliferation, or natural process of inflammatory exudations, draining and everything. And fourth one is cellular excitation. So by this all things, the cell gets excited, it gets repaired by itself by the tissue proliferation, by the proliferation of ions, and it gets healed by itself. So there are two basic principles or two basic mechanisms on which we need to give the energy by electrotherapy modalities, which is actually physiological. But when the physiology is hampered, we give artificial energy to the body by giving electrotherapeutic agents, and we either tickle the cell membrane or we cause the cellular thumping. Now what is thumping? Is giving higher energy. So these two things has to be understood by everybody, where tickling is needed and where thumping is needed. Now, for that, I would like to emphasize on one principle that is called Arnold-Skulls principle. So what is Arnold-Skulls principle? Says that whenever you give a minor amount of energy to any cell or any tissue, then it starts, the stimulus is sufficient, then it starts the effect or it starts responding. So there is a cellular exchange, there is a physiological changes happens into the tissue, but it does not, if the stimulus is of low level, then it cannot produce the much obvious effect. But if you keep on giving that, if energy or that um, energy from outside through the electrotherapeutic modalities, then there is onset of therapeutic effects. So initially we had the effect, physiological effect common. Now what, for example, what is physiological effect is increased blood vasodilatation. So vasodilatation causes increased blood circulation. Increased blood circulation causes increased nutrients, increased oxygenation, increased proliferative cells to the tissue which is damaged. So that is a physiological effect. Altogether, this would heal the pain, would reduce the inflammation, would enhance the healing. So that is the therapeutic effect. So starting with that, Arnold-Skulls law says that initially with a low level of energy, it starts stimulating the effects of therapeutic. It, whenever you continue giving energy, it reaches to its peak of the therapeutic effect. But here comes the turning point. If you still continue giving, or if the intensity of that energy is too high, then tissue stop responding or it deteriorates its effect. So that is Arnold-Skulls law. For example, if you can see this bus, if the bus is empty, you can enter, the passengers can enter into it with a sufficient amount. Like for example, 56 seater. So 56 people can get into. So it work efficiently. But if more and more people gets into, then it reduces, it stops responding. So it is like that. So when the tissue stops, when you give a higher amount of energy to the tissue, then it stops responding. So here comes the rationale for doses. So for example, sometimes we wonder that in clinical practice, for example, considering ultrasound, so there has given precise dosage for acute, subacute, and chronic condition, like dosage per centimeter square and duration also. But sometimes, not sometimes, I have seen in my clinical practice throughout these years into being into academy, still I have seen people practicing like, if I'll give more amount of energy with ultrasound, the tissue will repair soon. So they give more and more amount of duration. For example, if it is precise dose is 5 minutes, they give for 10 minutes. They feel that giving dosage for 10 minutes will double the healing process. But no, here comes the take home message here with through this Arnold-Skulls law is, whatever the sufficient required amount of energy is to be given only to the tissue. If you give more than that or if you give less than that, the tissue will not respond. So this is the base of electrotherapy, energy while you are giving to the tissue. Now looking to this is like, for example, we have seen the physiological effect. So delivering the energy that leads to physiological effects, that in turn, which I have already explained, that in turn leads to therapeutic effect like healing, resolution of inflammation, pain relief. So it in turn leads to therapeutic effect, which gives rise to relief to the patient. So patient overall gives rise to result, rehabilitation. Into the rehabilitation, whatever goals you have, you achieve that goal. And by this, you can come to know about the dosage calculation and treatment delivery. So it in turns a combined concept. So everything, the doses should be precise, the treatment delivery, like the mode of uh, giving the electrotherapeutic modality should be precise. Then the physiological effect should be kept into mind. Whatever the therapeutic effect you want to gain through this physiological effect should be considered while deciding the electrotherapy modalities. Now, here, as I will already explain, so it is up to you what you need from your energy, from your electrotherapeutic modality, whether you want cellular tickling, so you just want body itself to react to that electrotherapeutic modality and heal by itself, natural process, or you want cellular thumping. What is cellular thumping is, cell is already doing hyperactive or hyper irritated, so here you want to inhibit the cellular activity. So for that you need cellular thumbing, so for that you need a higher dosage, like IFT, like pain gate theory. So for pain gate theory we use high frequency current, or we use high frequency tens, rather than if it is cellular tickling then we use low frequency currents or low frequency tens. So that is how, what is the difference between this. So if you want to inhibit the response of body, then you just have to give cellular thumping, which is like giving a higher dosage of current so that the cell membrane does not respond, or the cellular activity gets inhibited. And if you want to enhance the cellular activity, then give cellular tickling. So here I have given the examples. Like if you want cellular tickling, then you need to give non-thermal energies like ultrasound, laser, pulse short radiotherapy. Or if you give cellular thumping, then you need to give TENS in IFT and MES, right? Now, so this is basic principle what you need to consider while deciding the electrotherapeutic modality, while deciding the dosage, while deciding its physiological effect and what therapeutic effects you want from the electrotherapeutic modalities. Now, what are the indications of electrotherapeutic modality? We use electrotherapeutic modality in many ways. Like we use it for pain management, muscle strengthening, muscle re-education, muscle relaxation, denervation, tissue repair. Tissue repair, like we use it for repair of the tissue or wound healing, or edema management, or circulatory management, or inflammation management. Commonly we actually consider electrotherapeutic modality for these two conditions only, and that is why we lack our involvement of electrotherapy while in clinical practice, because we feel that only pain management and inflammation management is done by electrotherapy, other things we can manage by exercise therapy. But it's not always. Exercise therapy sometimes needs adjunct electrotherapy modalities like low frequency currents for muscle re-education. If there is denervation, then you need a interrupted galvanic current to maintain the muscle property. Once the nerve is regenerated or establishing its pathway, then you need to have faradic current to aid the exercise therapy. Like wound management, there is no exercise therapy for wound management. There you need only electrotherapeutic modalities. Like edema management, also edema management can be done by exercise therapy, but when the pain is overriding, when the limb is not able to move, when there is stiffness, when the muscles are inhibited due to pain, then electrotherapy modalities work much more than exercise therapy. So that is why I said that electrotherapy and exercise therapy goes hand in hand. Now, if I, as per my perspective, electrotherapy is basically used for 4 physiological effects. So what are that 4 physiological effects? Is first is pain relief, physiological effects, that is therapeutic effect here. So first is pain relief, second is inflammation control, third is tissue. So any of these 4 is present in your patient, you can use the electrotherapeutic modality, but there has to be a wise selection of it. So what is wise selection here is, if there is pain relief, if you want to actually relieve the pain, then you need to use the low frequency and medium frequency currents only. So there is a myth that if there is pain, I will give SWD or IR or MWD and the patient will relieve pain. No, it's not for relief of pain. It's for other physiological effect which indirect gives relief of the pain. So that is a myth or misconception, I will say, not a myth. So if you want to get the pain relief, you need to go for low and medium frequency currents. If you want inflammation control, then you need heat and cold either, or you need a electromagnetic energy. Electromagnetic energy is like high frequency instrumentations. If you want to have tissue repair and healing, then you need to use the non-thermal energy, because already the tissue is damaged, there is inflammation, there is swelling, there is damage to the tissue, and you are increasing that by giving heat. So it is contraindicated here. So here you need to use non-thermal energy. And the fourth one is neuromuscular dysfunction, whether the nerve is injured or whether the nerve is damaged, or is there any higher function or high spinal cord injuries, or peripheral now neuropathies, neuritis, any conditions where the muscle is inhibited or muscle is like denervated, then you can use the low frequency currents. Now, first therapeutic effect is pain relief. So any condition which has pain is being relieved by two principles or two theories only, and that is either pain gate or pain modulation. As I said, no high frequency current or no electromagnetic energy can relieve pain. It indirectly relieves pain by decreasing the cellular activity. That is a different thing. But for pain relief, like getting the immediate effect on pain, you just have to use this two theories, that is pain gate and pain modulation. So what the electrolytic modality which works on pain modulation you can use. So usually the low frequency currents are used for pain gate and pain modulation. The commonly used low frequency currents or medium frequency current with the low frequency effect is IFT, and the low frequency current which is commonly used for pain relief is TENS. So you all know TENS and IFT can be given for pain. So if your aim to relieve pain in your patient, then you can use these two modalities only. So that is TENS, either conventional TENS or acupuncture TENS for chronic pain, conventional TENS for acute pain. Conventional TENS works on pain gate theory, and acupuncture TENS works on pain modulation. So low frequency current or medium frequency current. So what is medium frequency current? Usually initially for 1 week, you need to give like for 3 days constant 100 hertz, which inhibits the pain. And then later on you can add the variable beat frequency like 100 to 130 variable, and then 0 to 100 variable for other physiological effects of IFT, right? So consider this, wherever you want only pain relief, use this two modality along with the other. So in the last part, we will actually justify our use or selection of electrotherapy modality by this. Now, you all know how does pain gate and pain modulation works. So nociceptive stimulus can lead to pain, and the low threshold receptors leads to sensation of touch. If you give low threshold like A beta fibers, nociceptive are A delta and C fibers. If you want to inhibit the A delta and C fibers, then you need to use the higher frequency neurons or receptors. So what is that? Is the A beta fibers. So if you can stimulate the A beta fiber, which are fast sensation carrying fibers, then it or sensations, then it stops at the pain gate and at the spinal cord, and it does not allow the brain to perceive the pain. So that is there. So there are two terminology here, is hyperalgesia and allodynia. So what is hyperalgesia? Is excessive reaction to pain. Patient feels that there is so much of pain, even whatever the amount of pain is there. For example, there is nociceptive stimulus is there. So patient feels that there is so much of pain. There are two type of pain. It's a normal pain, like when somebody hurts you, it is pain. But when the tissue gets damaged, the pain is simple. The pain on pressure is something different, and pain on tissue damage is something different. So what is hyperalgesia? Is pain on tissue damage, right? So the low threshold mechanoceptor does not work much here because the hyperalgesia is overriding the sensation. Now, if you want to inhibit that, then you need to give some allodynia. That is a mechanoceptor. So you need to actually give some additional mechanoceptor stimulation by low frequency current or by any other means. There are multiple means of stimulating the mechanoceptors, and like acupuncture and other, there are many modalities, many ways rather, modalities. So you can use that by so this is the theory for pain gate. Now when the pain now is activity opens the gate, and by that the brain receives the message of pain. But if you inhibit that, if you close the gate by entering first, that is a beta fibers, other sensory nerve activity that closes the gate, for example rubbing the affected area. For usually we have that tendency, the pain gate we use by our protective mechanism also. Like whenever there is injury, we just hold the hand, we rub it, we palpate it. So that is how we actually input, we are in, giving the mechanoceptor stimulus so that the pain gate closes and we perceive less pain. This is pain modulation. So what is pain modulation? Once the pain is received by brain, brain itself release pain, releasing the intravenous opioids. So our pain cure, for example, this. So this is usually used for acute pain. Why? Because consider this. For example, there is pain, there is injury, and due to this damage, the nociceptive fibers stimulated, and due to that there is hyperalgesia. This hyperalgesia has to be stopped. Otherwise, brain would react to this hyperalgesia. Brain would send
Yes, ma'am, you can share again.
Ma'am, you can share again.
okay. Okay, I unmuted. Hello?
Yes, you can hear, ma'am.
I'm
You
audible.
can go ahead. Yes.
Okay, okay. So, okay. So it takes time for brain to release the endogenous opioids and block the pain. But during that duration, the patient is unbearable to pain. So during the duration, we can close the gate by adding the mechanoceptor activities or stimulation. So want the body to react. Till the body reacts and the pain is blocked or modified or modulated, you need to stop brain perceive. That is brain gate theory. So initially when there is acute injury, you need to use the pain gate theory for blocking the pain or relieving the pain, right? But once the I guess, okay. So this is what we actually use pain gate theory for acute condition. But once the tissue gets, once the brain, these nucleus. Once the it's modulate the pain, then pain is modulated. But still, it takes time to modulate pain. It time the opioid get excited, block all the nociceptors, and relieve all the pains. We can actually give pain modulation by low frequency TENS or by IFT also. So how does it work? So whenever we give pain sensation to brain, so when we want to actually increase the release of endogenous opioids from brain, so that our all the pains get modulated earlier or easily, then we actually add the pain. So when we give pain or when we give slow pain, that pain is been sorry, high pain, that is A delta fibers. When we stimulate A delta fibers, then brain, the thalamus, hypothalamus, and the cerebral cortex, they aspirate, they send the aspirates to periaqueductal gray matter, that is in medulla. They release the glutamate, and sorry, it's in midbrain. Then they release the glutamate to raphe nucleus in medulla sends the that is norendogenous neurons to the dorsal nuclei, and it modifies the pain. It releases the enkephalins, and then enkephalins prevents the substance free from the nerve endings, and post-synaptic inhibition occurs. So these all mechanism of pain modulation happens by body itself. But if you want to enhance this mechanism, you can stimulate the you can stimulate by giving A delta fiber stimulation. So you can give slow pain. So this pain would actually modify or modulate the pain. So here two theories are there. Either you want to stop the brain to perceive the pain, then pain get. Either you want to actually react the brain to relieve pain or to modify pain, then you give pain modulation. So any of the conditions, acute, we use pain gate, subacute or chronic, we use pain modulation. So in any of the condition, we use either IFT or low frequency currents mainly. There are other modalities also which works on pain gate, like slow heat, which works on pain modulation or pain gate also. But the dosage is very precise, and which we fails to give, and which increases the pain. So that is why we mainly use the low frequency currents. Now, the second physiological effect which we want is inflammation and inflammation control. So here comes, we actually need two things. Either we want to give electromagnetic energy, or we want to give the heat and cold. So there is a difference here. I just want to highlight two things into heat and cold. So if you want to use heat and if you want to use cold, what is or how to choose, or when to choose heat and cold, heat or cold rather. So heat is usually used in chronic conditions like reoccurring injuries or tight muscles, whereas cold is used in acute injuries like sprain, strain, and sudden back pain, or any acute condition where there is actually increased inflammation, tissue response, actually more amount of blood circulation is there, swelling is there. So you want to inhibit that. You want a vasoconstriction. You don't want vasodilatation. So where you actually don't want blood to go to the tissue and causes the more amount of inflammation. So you want to cellular thumping. You want to stop the cellular activity. So that cellular thumping is achieved by cold. So heat and cold, initially you can differentiate either acute or chronic. Then you use cold or heat. Then the heat is used to increase the blood flow, providing oxygen and nutrients. So whenever you want repair to the tissue, whenever you want increase in the metabolism of the tissue, then give heat. But when you want to reduce the swelling, reduce the inflammation, then give cold. Heat is applied into the area where there is pain, into the cycle of 20 to 30 minutes per hour. You can apply. This is for hot packs I'm telling about. This is not the electromagnetic energy heat given by electromagnetic energy. This is hot packs. Conduction heat. We are talking about conduction heat. We are not talking about the radiation heat. So here is the conduction heat and the conduction cold, or we call it as the cold energy is to be given by conduction method. So, and the and to it should be discontinued if the skin becomes painful or inflamed, and in the cold it should be discontinued if you feel that the skin is being frostbite or defreezed. So you cannot give much more amount of cold also. Now, electromagnetic energy. So I guess the wise use of heat and cold is being solved here. So wherever there is swelling, inflammation, give cold. Wherever you need tissue repair, you give heat. Heat is, I'm again saying that it is a conduction heat. So for example, you use wax bath, you use hydrocollateral packs, you use fluidotherapy, anything, but it is a conduction heat. So till the heat, the amount of heat energy passes from skin to subcutaneous tissue to the muscle level, the amount of energy is reduced so that you are not damaging the structure much, right? Here we are not talking about the electromagnetic energy. So next, what is the other energy which is used for inflammation control is the electromagnetic energy. So electromagnetic energy actually causes increase in the blood circulation, increase in the oxygenation, increase in the nutrients, causes tissue repair, release photon energy to affect directly at the cellular level. So the photon energy directly affects at the nucleus level as well as exchange of the ions. So these photon energy will actually gives rise to heating effect to the tissue or cells, and the depth of penetration depends on whatever the energy you are giving. So here is the electromagnetic spectrum, and what we are using, the part of electromagnetic spectrum in our therapeutic modalities is actually 3 or 4 things. One is shortwave diathermy, which lies here, which is like low frequency than the others, right? And the wavelength is higher. So we use shortwave diathermy. Then we use uh, microwave also. So microwave comes here in between. Microwave. So in between shortwave and infrared comes the microwave. Then comes the infrared. Then comes the visible light. But visible light we actually use for laser. So ruby laser or other laser, helium, neon, whatever. So here we use light, laser, and then we use ultraviolet. Ultraviolet is the highest the shortest wavelength and highest frequency. So it penetrates to the skin level only. Then the more deeper. So we will go from right to left. So the superficial is ultraviolet. Then deeper till the subcutaneous tissue is infrared. Then more deeper till the fat or till the membrane of the muscle, like superficial muscle, we use microwave, and shortwave diathermy is through and through heating. So we can use it through and through. Whatever the tissue comes in between 2 electrodes, the tissue gets heated up. Fine. So here comes your knowledge about the depth of penetration of the electromagnetic waves, so that you can utilize the or you can choose the instrument for or the modality. For example, if you just want to use the subcutaneous tissue till the subcutaneous tissue or the fascia level, then you can only use the infrared. Unnecessarily don't give other tissue heating by using shorter diaphragm, right? So if it is just a fascia level, use infrared. If it is deeper than that fascia, or if the fascia is situated, or if the muscle is situated deeper, but you don't want to reach till bone, then use microwave diathermy. And that is, microwave diathermy is more effective in myofascial back pain than SWD. SWD is through and through heating, where microwave reaches, like it penetrates till the muscular level or paraspinal muscles. So if you want to reach to the muscular level, use microwave. And if you want to reach to the deeper level or through and through heating, like hitting the shoulder joint, hitting the knee joint, hitting the sinuses, you use short wave diaphragm. So here comes the selection. Okay, whatever the tissue you want to heat up, you choose the model. Right now, the next one is so this is how it functions.
Electromagnetic fields act like mini particle pumps to regulate the sodium and potassium levels of all the cells. This constant regulation improves.
So this is how it increases the blood vasodilation. Am I audible?
Yes, ma'am, you are audible.
Okay.
Ma'am, your
I
video
guess
voice was
everyone
not
would be able to watch the whole video.
We can hear you, ma'am. You can continue.
Can you give me some feedback?
You
Okay,
can
I can.
continue, ma'am.
So, okay. So there comes another physiological effect of patient relief. Now, the physiological or therapeutic effect which we want from electrotherapeutic modality is tissue repair and healing. So this is what is the stages of tissue damage and tissue repair. So what happens whenever there is tissue injury, there is a vasoconstriction and the platelet aggregation and leukocyte migration. So this is what the pathological process happens. I would not go much into the pathological process. So when there is injury, there is healing phase. After healing phase comes inflammatory, where actually the macrophages, the phagocytes, and removal of the foreign bodies and bacteria happens. Then comes the proliferative phase where tissue repair starts repairing itself. So there is a fibroblast proliferation, collagen synthesis, extracellular matrix reorganization, and it happens with the granulation tissue formation, and then remodeling. Because during this proliferative phase, the tissue repairs, but it comes to its original shape and size by remodeling. So these four phases happens while there is any wound or any injury happens. So just a minute. Okay. So what we use for tissue repair and healing is non-thermal energy. thermal energy here we don't use much because the body itself is doing it. We are just giving cellular tickling by giving the non-thermal energy. So non-thermal energy uses doing does what it just excites the cell membrane. So there is increase ion, the normal ions of the body gets re-established. So tissue repair and healing has to be done by non-thermal energies like ultrasound, laser, and electromagnetic energy. So that is why here, if you actually just want to enhance the tissue repair and healing, just that, not inflammation, neither inflammation nor pain, you can use non-thermal energies like ultrasound, he Okay, so non-thermal energy causes just cellular tickling, and that is how it decreases the healing process. So here's the selection modality. If your target or if your therapeutic goal is to get tissue healing or tissue repair only, then you use the non-thermal energy. Like we use low level laser therapy, we use ultrasound, we use PEME, pulse electromagnetic energy. It increases the blood flow by giving cellular, by increasing, enhancing the cellular membrane transport. It increases the tissue oxygenation, it reduces the edema, it increases the antibacterial effect. So by this, during this inflammatory phase, this turns into proliferative phase where it increases the membrane transport. So it increases the cellular repair, it increases the collagen matrix organization, wound contraction, and stimulation of DNA and protein synthesis. So during proliferative phase, it enhances the healing or tissue repair. During remodeling phase, it increases the epithelial cell production and fibroblast stimulation so that there is a reorganization of cells or tissue, and we get. So that is how, whenever there is wound, we actually, or scar, for example, post-surgical scar or post-traumatic scar, everybody knows we can use ultrasound, but why we use only ultrasound, why we don't use SWD here, why we don't use heat and cold here, is the basic phenomenon to be utilized here, because we just want the tissues to be healed, to be repaired, to be remolded to its original shape. So that is why we just give cellular thumping, and it gives only the, it enhances the body's mechanism towards the injury. Okay, now the fourth therapeutic effect which we expect from electrotherapeutic modalities is neuromuscular dysfunction. So whatever the neuromuscular dysfunction is there, maybe it's an injury, maybe it's just a weakness, maybe it's just maybe it's inflammation of nerve, neuritis, or maybe it's a spinal cord. No, I'm not talking about spinal cord injury, but peripheral nerve injury. So maybe now entrapment or direct now in like exenetmesis. We can't use it for neuretmesis. We can use it neuretmesis till it gets repaired by surgery. Okay, so low frequency stimulation, the effects are so many. So what effects you want, you need to select the low frequency stimulation, because low frequency stimulation has a wider range, starting from galvanic current to the medium frequency current like Robox, Russian, and interferential current. So we have a wider variety of low frequency current. So what effect you want, you need to choose it wisely. So low frequency current causes muscle contraction. It causes by muscle contraction, it causes muscle pump effect. So giving Faradic current. Faradic is a high frequency current, which is which is similar to the currents which our body generates while there is propagation of the impulses into the nerves, and it causes the muscle contraction. So it is similar to that. So that is why when we want to actually stimulate the normal innervated muscle, we choose the Faraday current. But when the nerve is damaged and the muscle is denervated, then we use the galvanic current. So then we use the low frequency current, low frequency longer duration current, to maintain the properties of muscle till the nerve regenerates, till now established its conduction, right? So muscle contraction and muscle pumping action can be, muscle contraction can be done by either galvanic or Faraday. So wise selection of either galvanic or Faraday can be done depending on the condition. Then muscle pump action can be done by Faraday current. So low frequency Faraday stimulation can causes pumping action, can reduce the spasm, increase blood flow. It increases the neuromuscular function, activation of the muscle, and increases the strength of the muscle, and causes the physiological recovery. So wherever there is, like you might have heard about the strong surge Faraday current. So what is surge Faraday current is used for innervated muscle, but during the recovery. But what is strong surge Faraday current is high intensity, causes a strong contraction of muscle, which person or a patient cannot do voluntarily. So you give an immense contraction of the muscle, which is followed by relaxation, and that is how you relieve the spasm. So increases the physiological recovery or increases the neuromuscular function, done by choosing a wise low frequency modality also. There is a range of low frequency modality here, right? And the other one is effect the denervated muscle. So why we used electrical current into denervated muscle? Because there is a spontaneous firing of the injured axon, causing the twitching of the motor unit. So whenever we are giving additional outer current, outside current to the through the now, not through the now, to the neuromuscular junction, to the muscle or directly to the muscle fibers, there is a twitching of the motor units, and it gives spontaneous twitching of the individual motor fibers. So we give the galvanic stimulation here directly over the muscle, and due to that there is increase in the excitability. Sodium channel opens and there is increased excitability, and that is how it enhances the recovery of the muscle, right? And it allows the reinnervation of the muscle by motor axons. So stimulating the denervated muscle also gives effects on its recovery, right? Now, we have seen all the physiological or therapeutic effect what we expect, like nuclear dysfunction, tissue healing, inflammation, pain. But what are the modalities? Because I have given you the idea about low frequency, high, like hot and cold, or non-thermal, or thermal, or low frequency current. But actually, how many modalities are there in our spectrum of electrotherapy? So electrotherapy has three spectrum: low frequency, high frequency, and medium frequency. But we consider medium frequency and low frequency together because both of them gives the electrical stimulation, or it stimulates the neuromuscular tissues, right? So there are multiple choices into low frequency current. What physiological effects you want? For example, if you want pain relief, then you use TENS and IFT. But if you want to use the increase the muscle performance, then you use neuromuscular electrical, NMES, electrical stimulation. You use functional electrical stimulation for the patient. Sometimes we actually want to train the person muscle for functionally, then we use FES. Then we use Faraday stimulation, as I said, for edema reduction, like pumping action. Pardon me for some time. Then we want to get the ions infiltrated into the body by iontophoresis. Then we use high voltage pulse galvanic stimulation, HVPGS, for pain relief. We can use low intensity direct current for giving the muscles a strong contraction, dynamic current, H wave, then Reeboks, Russian, that are medium frequency current and microcurrents. Medium frequency current are usually used for hypertrophy of the muscle, because medium frequency has its low frequency effect, where you cannot ask the patient to go for that much frequent contraction, frequency of the contraction. There you use IFT for strengthening, or there you use the Russian current or Reeboks for strengthening. So we have a wider range or variety for electrical stimulation agents or modalities, but a wise choice for the therapeutic effect which you need is very much important here. Now, low frequency current has its spectrum. So I have just listed out few frequency to which through which we can get this effect. So if it is 2 to 9 frequency, then it stimulates the parasympathetic and it increases the blood flow. Then there is 20 to 10 to 20, which actually stimulates the smooth muscle fibers. So it increases the endurance, which is used for stimulating the smooth muscle fiber, like pelvic floor muscles are being stimulated by 10 to 20 hertz. And that is why we use IFT for incontinence, or we use Faraday current for incontinence. Then 20 to 30, like 15 is the C fibers and 40 is the A delta fibers, and beyond that is mechanoceptors. So whatever the range we want, we actually, if we want pain modulation, then use 15 to 40. If you want mechanoceptor pain gate, then more than 40. If you want more than 40 is 100 to 130, which we have already discussed. Then you all know that what is the tetanic contraction frequency. So it is 50 to 90. So at 30 frequency, 30 hertz, the muscle starts partial tetanic contraction. And then if you increases that, like muscle firing gets from 20 to 30, then we are at 30 partial tetanic type of contraction. Beyond 30, that is 50 to 90, you get a tetanic type of contraction. So whatever the effect we get from tetanic type of contraction, like contraction followed by relaxation, muscle pumping, increase nutrients, increase oxygenation, that all effects we can get by stimulating the muscle with 50 to 90 hertz. So we can use Faraday current during that. So 40 to 90 is muscle volume. So if you want to strengthen the muscle, 40 to 9, 70. Then if you want muscle volume is like strength. Here is the number of fibers fired, and strength is number of contraction, the hold or the strength of the muscle. And you can use 75 to 100, like 50 to 90. 90 is for the highest tetanic type contraction, and beyond 100 is explosive strength or hypertrophy of the muscle, and pain gate. So this is a wide range of specific frequency. You need to know, okay, what current. For example, NEMS is there, then NEMS usually use 40 to 100, because it is actually used for the muscle which is weaker. So you use that. But if it is denervated, zero grade, then you will have to use the galvanic current. So here comes the zero frequency, that is galvanic current or IG maybe, right? So that was about the low frequency current. A wiser and a rational low frequency gives right to excellent result. Because low frequency, there is no medicine or no other medical management which substitutes the low frequency stimulation to the muscle. There is no medicine which increases the strength of the muscle. There is no medicine which increases the pumping action of the muscle. That's only way is either you give exercise or electrotherapy. If patient is not able to do exercises due to inhibition, due to pain, due to other conditions, then you use electrotherapy to do that. Now, the second one is the thermal energy. So what are the thermal energy? Is the electromagnetic energy. Usually, not always. It may be conduction heat or maybe irradiation heat. So we have so many things into thermal energy like electrotherapy, IR, SWD, and MWD, which we have already seen into electromagnetic spectrum. The depth of penetration of ultrasound UVR is still the epidermis, and then superficial layer of dermis, and then IR is still the subcutaneous fat. So subcutaneous tissue, right? And the deeper one till the fascia is MWD, and through is SWD. So IR, SWD, microwave, and then there is another RF therapies, hydrocollateral packs, fluidotherapy, which is a conduction heat. Hydrocollateral pack is conduction heat. Laser is can be non-thermal, can be thermal. Wax is conduction heat. Cryotherapy is again conduction heat or immersion. So there are multiple, as we have already understood about the heat and cold and electromagnetic waves, what effect you want, you can choose it wisely. Non-thermal are pulse electromagnetic energy, pulse density. There is no cellular, only cellular. The areas you want the which is small, use ultrasound. But if you want to choose the area which is larger, then use EME. Depending on the size of the body part, depending on the which part you want to heat or give energy, depending on which structure you want to give the energy, you need to choose the electrotherapeutic modalities like pulse microwave therapy, then low intensity RF applications, ultraviolet radiation, static magnetic energy, pulse magnetic energy, microcurrents. Microcurrents are so much into practices nowadays. PEME. So all these are non-thermal, right? Now, recent advances, as the time is done, I would not detail into this. I will just list out the recent advances. There are cryo air, there are Thiel therapy, and then there are TR therapy that is irradiated, radio frequency therapy, there is high intensity laser, there is superconductive system, which is a high intensity electromagnetic field which generates, and then there is shockwave therapy, and then there is combination therapy of ultrasound and electrotherapy, or ultrasound and low frequency current. And for all this, like considering the therapeutic effect, considering the principles of electrotherapy, listing electrotherapeutic modalities, normal, thermal, low frequency. Here comes the taking, like what need to do. So be wise, be I have or principles from the electrotherapy modality, because I have found that there are many more unethical practices on the name of electrotherapy, where patient does not know what is actual effect of electrotherapy in my condition, and you keep on giving, earning the money. Because like if you don't give 2-3 modalities together, patient would feel that I am not being treated properly. So here comes, you need to be wise enough to explain the patients about the therapy or modalities which you give and what is its effect. You need to be truthful. Like you need to be honest to the patient that if it is just IFT is needed, then give IFT only. Don't give multiple things together. Because in initial phase, only you will get I'm so sorry, network. I don't know what happened, what is happening it with today, but I'm so sorry for this. Uh, you need to be truthful to the patient, because a patient needs a wise and ethical advice from you. They trust you. They trust you not raising the energy, like where it is needed, wherever it is needed, don't give. And be faithful to our profession. Be faithful to our gurus or our teachers who are taught to proper, how to use our resources. At the end, I would list out that practice puts brain to your muscles. So keep on practicing, but investment in knowledge pays best interest. So you have to learn it and apply it. Do not just follow one thing or two things which you have just put and then applied. Keep on practicing. Keep on observing the recovery from the patient. Keep on observing the reinfection, and then realize. So the who is learner, they progress by knowledge becomes and effort. Effort done who practice. Uh, and what is your message is take effective decision making. So where to hold and where to leave, or when to hold and to leave. If you are able to treat the patient, why leave? Should refer the so refer the patient, devise the treatment protocol. Whatever energy is required to give. Don't give excessive energy to the patient, which may damage the tissue. Like I have seen therapists who are giving shortwave diathermy for long months and months together. But that shortwave diathermy may damage the tissue, or it may not damage tissue in 1 or 2 days. It will damage the tissue later on in a long way, like the tissue gets, the muscle gets lose flexibility, the muscle fibers fibers do not get the lessening of its contractility, or the loosened down, or the tendon. So take a wise and effective decision making. Thank you so much. Thanks for the kind attention, and sorry for my hello. Hello.
Yes,
Now
ma'am, we
Hello.
can
take
hear. We can hear.
questions, or we can conclude this.
Okay, okay.
Yeah.
Sadhu sir, is there was
Okay.
any question? So you can ask, otherwise we can conclude.
Ma'am, I would say it's a very elaborative all about the electrotherapy, and throughout the part from the starting or from the low frequency, from the medium frequency, and the high, we have cleared all our doubts. Okay, so I am finding it out. There is no doubt on the YouTube, and if anybody would be looking to ask up anything, so he can come up on the YouTube chat box, and madam will give directly the answer.
Okay. I'll directly
Yeah.
answer that.
Thank
Okay.
you, ma'am. Thank you very much for. Definitely, I would say you have simplified the electrotherapy. There was a lot of doubts was there in our mind, and at this stage, I am finding it out. Electrotherapy is so interesting. We should give focus onto the electrotherapy, and definitely a lot of researches can come to the topic. Thank you, ma'am.
Thank
Thank
you
you.
so much.
Thank
Thank
you,
you
ma'am.
so much, and it's
Thank you, ma'am.
my
Thank you
pleasure
so
to
much for
enlighten on this
yes.
topic. Thank you
Thank
so
you,
much.
ma'am. Thank you, ma'am.
Thank you so much, ma'am. Thank you.